When you go to the doctor to get your flu shot, have you ever wondered what goes into that shot and what happens in your body? Well, today I will tell you all about vaccines. My main inquiry question is, what is involved in vaccines development and testing? How do they affect the human body's immune system? And what are the primary challenges for administering vaccines? First off, what is a vaccine and how do they work? A vaccine is a disabled or weakened part of a disease that the body recognizes as the real thing, so will be ready with the antibody when you need it. An antibody is a Y-shaped protein that your B cells create to stick to an antigen with one end, and the other side sticks and activates cells in your body. This can mean different things for different cells. For the T cells, the protectors of our immune system, it means to attack the antigen. For the B cells, this means to create antibodies of the same type. And for some other cells, it can mean to activate different parts of the immune response. Vaccines are developed in different ways. One of them is basically weakening the disease. This is done by taking the viral or bacterial genes out of the disease. This disables the disease's ability to reproduce, so it cannot infect a healthy body, but can be recognized by the immune system. Another way of developing a vaccine is using a chemical that will completely destroy the disease. This method is good because it can be given to people with compromised or sick immune systems, while other methods that involve the vaccine being live cannot. A downside to this method is that it can take several doses to reach immunity because it relies on the body seeing the disease. After a vaccine is created, it is put through multiple tests to make sure that it is safe and works. First and foremost, the vaccine is inspected in a lab by hundreds of scientists and government officials. They are also commonly tested on animals. Next, the vaccine is put on what is called a clinical trial. This is when it is first tested on humans. Thousands of people are tested with experts watching and taking notes. The next stage comes when the vaccine is approved. This stage is called the post-enclosure studies. This stage continues testing and makes sure that no problems went unnoticed in the previous stages. They often test on groups that were underrepresented in the clinical trials and are mainly looking for uncommon reactions to the vaccine. Vaccine administration has a lot of challenges, but one of them is you have to get the exact right needle for each person or the vaccine might not reach its destination. Some other challenges are that some vaccines have more complex administration, like using several doses or applying to a different spot. And last but not least, the person administering the vaccine has to make sure that the patient is completely healthy or the vaccine could negatively affect them. Did you know that most vaccines have taken years and years to develop, test, and approve, but the COVID-19 vaccine is expected to come in only 1 year, 2021. For more information, visit my blog at blogs.scarsdaleschools.org/vdundon27.